Hi guys, I'm Arjun, and we are starting our first podcast at Prewel Labs. And today we are going to talk about water, basically everything about water. And our guest is the founder of the company, Mr. Ambrish M. Ghali. So I would like him to just introduce, a brief summary about Prewel Labs and
Okay.
yourself.
Yeah.
So yeah.
Yeah. Hi, Arjun. Um, yeah, I am Ambrish, and I'm founder of Prewel Labs.
Mhm.
We started this company in 2021,
Mhm.
and the whole objective of starting this company was, to the purpose was always to build healthier communities. And before this, I and my other partner Prashant, we have worked for various pharma companies.
Mhm.
And what we realized when we were working in the pharma companies is the importance of the quality
Mhm.
that they give when they're manufacturing these medicines. It's for the obvious reason because medicines are consumed by patients,
Correct.
and it is supposed to cure you of the diseases.
Mhm.
And hence we see that pharmaceutical companies, they
Mhm.
work at a very high quality standards.
Right.
And I was a part of the quality control team there,
Mhm.
and I worked 5 years there. So one thing that's kind of strike at that point of time is like when pharma is operating at that high standards,
Mhm.
right?
Mhm.
And medicine is something that I believe nobody wants to consume.
Correct.
But ultimately, if they're not feeling well, if they're sick, then of course the doctor recommends you to take medicines.
Right.
So the point what I'm trying to make here is that you don't consume medicines on a daily basis,
Mhm.
yet it operates at so high quality standards.
Right.
But when it comes to our basic necessities,
Right. Right.
it might be your water, it might be food, it might be your air,
Mhm.
right?
Mhm.
It might be any product that you're consuming.
Mhm.
The amount of what do you call the quality standard what we see,
Mhm.
there's a long way to go.
Right.
And the major problem what I believe has also been the lack of awareness.
Mhm.
And
Mhm.
I believe that one of the objective that we have at Prewel Labs
Mhm.
is also to educate
Mhm.
and bring awareness to our consumers,
Right.
to make them understand what they're putting into the bodies.
Mhm.
So I think that's the whole theme.
Mhm.
This was the objective why we started Prewel Labs.
Mhm. Mhm.
And it's been a fantastic journey, and happy to be here
Mhm.
to discuss more on this topic.
Great, great. Thank you for your introduction. And like as you mentioned, that whatever we are consuming
Mhm.
is not at the highest quality.
True.
And specifically in India, like
Mhm.
the countries which is developing.
Mhm.
So if we compare from the West, so we have long way to go, right?
True. Very true.
So the as you mentioned that we
Mhm.
are doing this podcast also, and all the marketing effort that we are doing at Prewel
Mhm.
Labs
Mhm.
is focused on educating the
True.
customers. So keeping all those points in my
Mhm.
mind, I will be asking you, basic questions about water.
Okay.
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 So today we'll dedicate the whole podcast to water only,
Mhm.
and we'll try to understand the basic fundamentals of why
Got it.
we need to consume the best quality of water, or the I think that is also the basic necessity
Mhm.
which we don't get here in
True.
India, right?
True. True.
So, and India is a vast country,
Mhm.
and after every few kilometers the quality of water changes, keep
Mhm.
on changing,
Mhm.
right?
Mhm.
So we need to understand
Mhm.
this knowledge, where every Indian should
True.
they need to understand this,
Yeah.
right? These should be in our textbooks, but
Very true.
unfortunately we are not having those kind of education which is focused
True.
on our health.
Yeah.
And I myself is a very health conscious person, so
Mhm.
I have been following all these things related to health, from a very long
Mhm.
time.
Mhm.
And that was one of the objective why I joined here also,
Mhm.
and
Mhm.
working and leading the marketing.
Mhm.
So it would be a nice conversation, I
Of
guess.
course.
Yeah. So like starting with the fundamental, if I
Mhm.
ask you,
Mhm.
like why should a average person,
Mhm.
like aam janta we are talking about,
Mhm.
should care about water?
Okay.
Because in India we see like people are busy in themselves only,
Yeah.
right?
Yeah. Yeah.
They don't care about health, what
True.
they are eating, what
True.
they are drinking. They are just surviving, I would say.
True. True.
Right.
True.
So just I want you to focus
Yeah.
on this point.
Okay. See, before I would delve into
Mhm.
this topic, Arjun, uh, I believe it is everyone's responsibility, and I believe more importantly, I think it is an individual's responsibility to take care of their health.
Correct.
Right?
Correct.
And
Absolutely.
I believe anyone who's been sick at times, right? Uh, you don't feel good about doing anything, right?
Yeah.
The only thing that your focus is, how can I get quickly well, so that I start doing my normal routine.
Correct.
Right?
Yeah.
But ultimately what happens is, until and unless we don't go to that kind of situation, we sometimes never really appreciate what we have with us. I think health is a huge subject. A lot of things that come into health, right? It means I'm currently reading a book called Outlive, right? So very well written book. I would in fact recommend people to read that book. Someone who is very health conscious and they want to understand the fundamentals of how our body operates and what we should be doing, right? And more importantly, what the medicine 2.0, that is what they mention in the book, which simply prescribes medicine, and that too at the last stage, right? Outlive talks about medicine 3.0, where they talk more about the preventive aspects of it. And I think this is very important to this conversation also, because that is what even the author talks there. Right? Not many people, in fact, the current medicine system also, they treat you only when you are at the last stage of it. Right? So it is important that we take care of our health, and one primary, of course, part is what we consume. So as I think water is fundamental. 70 to 80% of our body is made of water.
Correct.
Right? And if you go to a cellular level also, 80-90% of the cellular composition is made of water. The earth contains 80 to 90% of the water.
Correct.
Right? So water has been a important aspect of humans evolution. Not just human evolution, I would say it is an integral part of the entire animal evolution.
Right.
So it might be humans, it might be animals, anyone for that matter. I believe that water is something that keeps us alive, and hence the quality of water that we actually drink makes a bigger difference. And I believe in this podcast, in this conversation, we want to go deeper, right, on why the water quality is so important for keeping us healthy.
Yeah. Great. So, if I ask you, what are the some signs that the water might not be safe, and even if it looks, safe and clean, so what are those some signs?
Okay. See, the unfortunate part is, only when we see water with dirt, only when we see that the water is not clear, and if any water is clear, we believe that it's safe to consume.
Yeah.
But that's not the case. I can just give you a simple analogy here. Like even the DM water, the battery water, right? It looks very clean,
Yeah.
and it is completely devoid of any minerals. But can we drink it?
I don't think so.
Yeah. If you drink it immediately, once the water goes into your throat, because it has no minerals, okay, then it starts extracting your minerals, and then it might even kill you. So the point what I'm trying to say is, not everything that looks clean or not everything that looks dirty, and we cannot make a conclusion based on that whether the water is safe to consume or not. But however, a few indications, right, which of course our normal eye can't see, right? Microbiology contamination, you cannot see.
Yeah,
right?
right,
There
right.
is the one common source of contamination today is E. coli. There are a lot of reports, right, including in a lot of magazines have published this data for Bangalore and many cities, especially the metropolitan cities, where they have identified this E. coli as the source of contamination, right? So microorganisms like E. coli cannot be visible through your naked eyes, right? Though they are present in that, right? What you can see is the dirt, or probably sometimes the turbidity, or sometimes suspended particles. So that's something they can see. But common science is, whenever you see the water, right, always go with intuition. If you feel that the water is not good to consume, then you should stop there.
Right.
But if it is dirty, of course, you know that the water is not fit to consume. At the same time, just because the water is safe, right? I mean, it's clean, it doesn't mean it's safe. So it's very difficult for someone who is not coming from that scientific background or the lab background, just by looking at the water and come to a conclusion whether I can drink this water or not. Right? But a foul odor, sometimes you get a bad smell from your water. It might be sometimes from your corporation taps, or sometimes your filter itself, the output, or sometimes the borehole water, or sometimes the tanker water. Right? So you can sense that, no, the kind of smell that you get. And sometimes the taste, very difficult, because taste is very subjective. But sometimes you might feel an off taste. Okay? And visually, if the water is turbid and it's having some kind of visible contamination, then that water is something that you should not be consuming. You need to make sure that you're getting it tested.
Got it. Means testing the water is very crucial.
Definitely.
Everybody should do it. And
Yes.
as you mentioned, that if it looks clear also,
Yeah.
then it's not.
Yeah.
We cannot say that it is.
There's
safe.
a term what we use, portability.
Yeah.
Since it's a very technical term, but in layman terms, whether this water is drinkable or not is what portability is. So there is a specification which is set by the IS standards. That specification is IS 10500. Anyone can Google it. So it gives you a set of parameters, which are the parameters that you should actually get your water tested for, with the limits.
Okay.
For example, there is a parameter pH, right? Not lot of people know commonly about pH.
Yeah.
So pH should be somewhere between 6.5 to 8.5.
Right.
So if it is either of these limits, then the water is not safe to consume. If you take TDS, right, it can be less than 500, and sometimes it can go up to 2000 also. So you would get to know what are the test parameters that you can test, okay, and what are the limits. If it is within limit for those parameters, then we say that this water is potable. Or we as a testing agency, we never declare anything. We never certify anything. We just say that whether your water is kind of complying or not complying to these tested parameters is what we do. So we recommend that, no, people have to get their water tested, because it's very difficult, as I mentioned, for a layman to just see the water and then tell that whether it can be consumed or not.
Yeah, correct. So moving ahead, we are in the cities like metro cities like Bangalore, Mumbai, Delhi. So specifically about Bangalore, as we are right now present in Bangalore only. So what do you think? What is the quality of water here?
I think I would say it's heterogeneous. When I say heterogeneous, it's not the same quality everywhere. Because what happens is Bangalore predominantly depends on Kaveri water supply. Right? That's the major source of water for most of the Bangalore city. And I'm talking about the integral part of that. I mean the old Bangalore, what we say. Right? The Kaveri extension is also going to the new areas. It takes time. But if you take about Kaveri water, our experience says that because again this is managed by BWSSB, I would say that 99% of the times the water that they're supplying is good to consume.
Okay.
Yeah.
Great.
Yeah. Only we have seen cases when, because what happens, I think people need to know this, your the BWSB line and sometimes your drainage lines, right, the bigger ones, they're running parallel.
Okay.
So any construction work is happening, right? So if this gets damaged, that is where probably the mixing happens. Right. It's not like at source your Kaveri is contaminated, but during the transportation in the pipeline, somewhere there is a damage and there is a mixing of water happening. Then that actually leads to the contaminated water being supplied. But otherwise, if you talk about the borehole water, right, of course it varies a lot. Right, probably your east part of the Bangalore, the Whitefield areas and all, you can expect very high TDS, right? Whereas if you talk south part of the Bangalore, right, your Banagatta roadside and all, the TDS is there, but not very high compared to what we are getting in the east part of the Bangalore. So it is, I would not. It's very difficult to tell, because fundamentally people need to know where the water comes from. It comes from water table, and water table also varies. Right? It varies geographically. Right? Somewhere there is a lot of limestones, other calcified materials, and you can usually expect a very high TDS and hardness there. Right? So it's very difficult to tell, but it's diverse across Bangalore. You get to see all kind of water. This is coming from the source borehole. What is I'm talking. But if you are also talking about tanker, if you are an apartment association or you are not getting enough water from Kaveri, then you're depending usually on tanker waters, then that's where the biggest risk is. And I think this is where a lot of people need to be aware, because nobody knows the traceability of this water. What I mean is, nobody knows the source of this water. Where is it coming from? from?
Tanker
Tanker waters.
Yeah.
So tanker water is also one of the major sources in Bangalore today.
Right.
I also stay in an apartment community, and recently we got a message saying that there's some work happening with the Kaveri, and then you expect a disruption. Then now we're depending completely on the tanker waters. So tanker water, of course, again, where that water is coming from is something that you should always ask the supplier, and not just that, you should always ask for a test report.
Correct.
So when it comes to the water quality, I would say that it is heterogeneous. Like Kaveri is consistent, good quality. Boral water varies depending on which part of the Bangalore you're staying in. And tanker water, of course, you need to identify from where the water is coming from. And then that's how the quality of water is varying.
Got it. Means you should ask for the report if you are dealing with a tanker water every time.
Of course,
right?
Of course.
Great. So, like in the household water, what do you think? What are the most common contaminants in Bangalore, if we talk about?
Okay, we broadly classify these parameters into three different categories. One we call it as physical parameters, one we call it as chemical parameters, and the third one is microbiology. If you talk about the physical parameters, your pH, your conductivity, right, your color, right, this all comes under your physical test. But when it comes to chemical, the common terminologies that people know is hardness, right, and how much calcium is there, how much magnesium is there, how much TDS is there, how much nitrate is there. So these all come under the chemical. Even this includes your toxic elements, which we commonly call heavy metals, right? So it might be your arsenic, it might be lead, right? It might be chromium. So there are a lot of heavy metals, right, which are actually toxic. So that also is a part of the chemical testing part. Then we have microbiology. As per IS 10500, again it recommends you to do testing of two categories of microbiology parameters. One we call it as E. coli, and the other one what we call as total coliform, right? So if you're talking generally about physical parameters, pH is very critical, because if your water is not within that pH limit, right, so you would have health effects. Now one common problem I'll tell you, the biggest myth today is the water is coming out of my filter. It might be a brand A, brand B. I assume that the water is of great quality.
We'll discuss this point in more detail.
Yeah. So what happens is, when you are actually looking at the parameters, these are generally few of the parameters that we usually ask people to look for.
Okay.
So but at home, if you're talking, the indications would be, let's say you have a kitchen at your home, and the sink, you sometimes see if the sink is of the black color of your granite. Right, you can see a discoloration. You can see whiteness there. That means the water is actually hard.
Right, correct.
Right. So sometimes what happens is your metal, all your utensils and all, you can see a white layer around. Yeah. So that means your water is hard. Sometimes your geysers, you see that suddenly kind of white dust coming out. Then your water is hard. So the hardness is one parameter that is very easy to identify. But apart from hardness, I don't think anything else can be recognized by normal layman at home. You have to get it tested.
So, like, by your experience, like, what are the common contaminants? Like, after we have done so much of testing and also, what are the common contaminants that you have found?
Okay, one is of course TDS. TDS is a very classic problem. Usually we see that the TDS, especially if you're depending on a tanker water or a borehole water, the TDS seems to be very high, but not the case with Kaveri water, because it's already treated. Your pH tends to vary, okay, and your hardness, because usually we see water with a lot of hardness, and in rare cases we have also seen high iron content and high nitrate content. Okay. So these are usually the contaminants. But when it comes to the tanker water, and sometimes your stored water, what we call in apartment, they have spaces called sumps, right? They overhead tanks. If they're not cleaned properly, if they're not maintained properly, then you can also expect some kind of your total coliform contamination. Okay. So these are usually the contaminants that what we see commonly for all kind of water samples across Bangalore.
Got it. So as you talking about that RO and all, right? So many people have that it's a very general myth, and I would say it's a marketing gimmick also. From the bigger brands who are spending a lot of money on marketing that if you have put the RO filter, then you are done. Like RO is god of water, like it can filter everything, and you don't need to do any testing after that. So what are your thoughts on this?
Okay, see, I would always suggest that if you really think that your water quality is good, and don't just think, I'm saying that if you have evidence that your water quality is good, I would suggest not to use any kind of filters.
Okay.
Right, because filters was an invention again by industries, and of course they're helping us filter the water, but if you are using a filter, always understand that your whatever you're drinking is not the natural water. Right, there might be a lot of variants or a lot of models from different companies, but again, with my personal experience, even I use a water filter at home, right, because the source is not consistent. Okay, but it doesn't mean that just because I have a water filter, I believe that water which comes out of it is clean. Of course, you have to take care of the maintenance part of it. I'm not talking about that. Assuming that you are taking care of your filter well, maintaining it well, what we have seen is a lot of cases which comes to us, right? People say that we have complaints about acidity, right? And we don't know. We went to the doctor, and doctor said you just get your water tested once. And a lot of times we could see that one of the reasons of acidity is also because they're drinking low pH water, right? What happens in your RO filter, any brand for that matter, it basically first takes out all the minerals.
Okay.
Right, so what happens, it's not controlled. Like, you should have a good water, right? If you want how do I define a good water? A good water is something which comes with a TDS of even 200 to 400, which has a hardness of around 80 to 100, right? Because water has a lot of minerals in it,
right.
And this hardness, this TDS is all contributed by the minerals only. But of course, anything which is beyond your limits is not good.
Right.
So what happens is, like, when the filters work, they try to take out all the minerals out of it. And then what happens, because the minerals are going down, we have seen, in fact, filter waters which we were surprised that the TDS is hardly 10 or 20. And the pH is almost, some cases it has gone to 5.5, 5.6, which is lesser than 6.5, which is the limit. But people think they're drinking good water. Right, because that's the perception that we have.
Right.
What we tell our people is, like, first you identify. You always need to first identify what is the source water.
Right.
If your source is consistent, right, then if you believe that you need to filter that water, then we usually tell it's not always that you have to buy a RO filter water. If you don't, if your chemical elements or minerals are balanced, okay, then you need not go for an RO water. You can just go for a UV, right? There are different kinds of water filter, right? So UV is responsible for decontaminating. So if there is any microbial contamination in your water, then this UV filter will take care of it. However, your 100% minerals are retained there. But not many people know this. When they go to the market, they just go and pick the best filter there, and ultimately the guy who is selling them wants to sell the product with the highest MRP value, right? So I believe people should educate themselves. They need to know how the filter works, not fundamentally going too deeper, but do you really need a RO filter? Do you need a RO plus UF filter, UV filter? You should at least have that basic understanding.
Okay, so you are saying, like, before buying a filter also you need to test your water, right?
Of course. See, for your filter, your water is a raw material, right? If you don't know the quality of the raw material, then how do you know if your filter is really working or not?
Right.
The common test, because even I am a guy who owns a filter, what usually these people come and do is they bring a handheld TDS meter. Right? They come and open the tap, and then they put the, and they say, "Aapka TDS itna hai, aapko isko niche layenge hum log," right? That's the only objective that they train. But that is just one indicator parameter there. Like, you have other parameters which you need to test, and only when you know, like, okay, this is what my quality of raw water is, then you would be in a better position to make a decision. Should I go with this kind of water filter, that kind of water filter? I'm not talking about brands, I'm talking about the combination. Do you need RO? Do you need RO plus UV, or only UV or UF? Whatever it is. You need to know the raw water quality first.
Got it. So, like, before taking the filter, buying a filter, you should,
of course,
do the testing.
Yes.
And also after installing.
Of course.
Right.
Yes.
So what should be the frequency of that testing after installing?
See, what happens is, usually the rule of thumb is water table, okay, changes every season. What I say is, the quality of water in your water table, okay, changes every season.
Okay.
So in India, predominantly we have three major seasons: summer, winter, and rainy. So what happens is, the quality of the water table underground is changing. Even if you are bringing it from a water tanker, because even he's bringing from the same borewell only, it might be some other locality, but ultimately the source of water for everyone, as long as it is coming from the borewell, either from the tanker or from your own borewells, we recommend that they have to get it tested at least once in a quarter. And this becomes much more important if you have young kids at home who just born, whose immunity is still not developed, or someone who already has some health issues. You might be already having people at your home who have dialysis, I mean who have kidney problems, right? So those again are high priority, people you need to take care of. And also old, if you have someone of old age at your home, we believe that water is important to be checked. So once in a season, we would recommend that they get it checked.
Got it, got it. So you were talking about parameters, right? So how many parameters are there, and how many anyone who is testing the water? So how many parameters they should test?
Okay. See, this is very subjective. However, because there are a lot of factors here. If you want the entire IS 10500, which comprises of around close to 75 to 80 parameters, if I'm not wrong, which includes your pesticides, which includes your heavy metals, which includes your regular physical, chemical, and microbiology parameters. I would say people in the market, it ranges from somewhere around 8K to up to 15K.
Okay, this is the
per
price.
one sample. Yes.
This is price.
Yes.
Okay.
So that's the price of testing the water, but we would not recommend everyone to go for that package.
Okay.
That's a very rare instance. Okay. General package that we prefer is it's a 20 parameter package, which we have selected based on the data, right? On what parameters you should be tested, and we also ask a certain set of questions. For example, let's say you're staying close to an industrial area, right? Industrial area, a lot of industrial work happens, and common contamination is your heavy metals. Right? Then we say, okay, because you're staying very close to the industrial area, we recommend you, along with this 20 parameter package, you also go with these heavy metals. And you'd be surprised to know that whenever we recommended, we've seen most of the cases the water is contaminated with the heavy metals.
Okay.
And if you are someone who is staying close to, let's say, a lot of agricultural activities, right? Then what happens? You can expect pesticidal contamination there, because farmers use a lot of pesticides, and that water is carried and then it comes. So we don't just tell one size fits all approach. This is where Prewel Labs also brings in the expertise. We understand, we go deeper and understand what's the reason why they want to get it tested, where do they stay, and what kind of population stays at their home, what age group, do they have any issues and all. Based on that, we usually recommend them. But the common package that we recommend is what we call as a 20 parameter package. That cost you somewhere probably between 1800 to 2200 rupees.
Got it. So we're not just doing the testing, we are actually consulting the people.
Exactly. So consulting, what happens is usually people talk consulting post delivery of a product or a service, but here it's pre.
Oh, great.
Right? We do pre-consulting because we want giving report is the one of the objective of it, but that's not going to solve it. We want to understand why exactly the customer has come here, what are the pain points, and how can I solve them. And then along with that, once the report comes, we also give them necessary recommendations what they can do to improve the quality of the water.
Great, sir. So moving forward, like as you were talking about newborn and old age people, so what are the common risks that if somebody is drinking contaminated water, so what are the common risks that they can get?
Okay. See, one is when it comes to the chemical parameters, right? Again, I am not someone who is just trying to convince everyone to get the water tested, but when we look at the data, right, till today we haven't found much of scientific data on what are the health side effects if you don't drink the right quality water when it comes to the chemical parameters, right? Excess of calcium, excess of hardness, excess of some regular magnesium and all, it's not a concern for you. But if you're drinking someone like excess of fluoride, right, excess of nitrate, then there is usually a lot of other, you tend to get into a lot of health issues. Like if there is excess of fluoride in your water, you can see a discoloration in your teeth. You can see that your teeth is kind of becoming more yellowish, and it leads to, I exactly don't recall the condition, but it leads to the weakening of your teeth, right? So these are the indications. But if you talk about heavy metals, see, another problem here is water issues. When there's anything wrong with your water, right, it's not acute. What I mean is, it's not sudden.
Yeah.
Like you drink a
Yes,
water
yes.
with heavy TDS, high nitrate, it's not you're going to die immediately.
Yeah, yeah,
Right? See, that's where the problem is. Because the results are always compounding. Right? It's a chronic issue. So you are drinking a water which is contaminated with heavy metal on a daily, especially if you're talking about heavy metals, it impacts your kidneys and your kidney functioning goes down. Right? Because your body is constantly working to throw those heavy metals out. So what happens is, it's a chronic, it's a slow process. So if you're drinking water which is contaminated with any of these, like recommended limits, if it is above the recommended limits, then of course you will feel the issue. But the one thing which you can immediately experience also is if your water is having E. coli contamination.
Okay.
So E. coli, I'll just explain briefly. E. coli is called as an indicator organism, and E. coli is usually found in the fecal matter of humans. So what happens is, whenever you see that your water is contaminated with E. coli, that means somewhere there is a drainage contamination. Yeah, the water is cross contaminating the source, and hence E. coli is used as an indicator organism.
Okay.
Right? E. coli as such is not harming you, but excessive E. coli, of course, will again have you'll have dysentery, you'll have vomiting. So microbiology contamination is rapid compared to the chemical, which shows years to take. But if your water is contaminated with E. coli and heavily contaminated with E. coli, you will definitely experience it probably in the next 48 to 72 hours.
Oh, that fast.
Yeah, that fast. And in rare cases, there is a possibility that in rare cases people have even died because of water contamination. And diarrhea, you see the statistics, is one of the leading cause of the child's death today. Globally, it kills more people than all the terrorist activities that happens.
Yes.
But still today, not anyone. There are a lot of organizations who are working very seriously. One is Bill and Melinda Gates Foundation, who've been working a lot. There are a lot of other organizations also who are working on bringing down this diarrhea. That's a bigger problem today, and the major problem with the source of problem is being your water. The contaminated water is the reason for why so many kids die because of diarrhea today.
Got it. So, like, can poor water quality affect cooking and skin problem and hair fall also? Like,
yeah, I think as I said, water is an essential ingredient in everyone's life, right? We also get a lot of calls, people complaining that their hair, suddenly they're losing a lot of hair, they see skin rashes and dryness on the skin. And so these are common issues if your water is, it's not just about drinking or potability. If your water is having heavy chemicals in it, right, then it might also lead to all these problems. You will have high hair fall comparatively. You would have heard, right? Like suddenly you see someone going bald, they ask like, "नहीं पानी का problem है यार, यहाँ लगता है कि पानी set नहीं हो रहा है."
Yes, yes.
What they're trying to tell is basically it has heavy minerals in it above the recommended recommended dose, and then because that is kind of causing all these problems.
Right.
So yes, and even if you talk about cooking, yes, it will it will take, like, if there is a lot of contamination, let's say the water's boiling point is usually 100 degrees. So if a normal water you're cooking, it cooks fast, but if you're using very hard water, right, it takes more time. So for someone, probably it might not a big difference for someone at a household, but if you are a kitchen, it might be a cloud kitchen, you're running a restaurant and all, probably you might be burning a lot of gas to boil this water. So that is also a kind of extra cost that you are incurring. So that also has a kind of impact there.
Okay, got it. So, like, moving towards the next segment, there are a few myths what people usually says. So I would like to address 3-4 myths, the most common myths, and I would like you to just give the clarifications.
Sure.
So first one is, I have been drinking this water for years and I am fine. Okay, what's the reality?
See, I just mentioned you that water contamination, drinking contaminated water, especially if it is having high elements and toxic elements, it's not an immediate thing that you notice. It's something that you will experience over a long period of time. So this is chronic. I've been drinking this water for a very long period of time. It doesn't mean that you'll not face. There would be, of course, issues with your health, but you're just not seeing it yet.
Got it. So you're saying it will take times, it can take years
Yeah,
to
of course.
show the result.
Of course.
So you should not be, fine with this.
Yeah.
Like I have been drinking this water
Exactly.
and I am
Yes.
absolutely fine. So you should do the testing every quarter as you
True.
recommended, right? Next myth is like if it's we have already addressed, but again I'm asking you like if it's government supplied or RO filtered water, then it's definitely safe. I don't need to do any testing.
Okay.
Yeah. So I just want you to just summarize this
See,
in one
government
line.
supplied water, as I told, they would be of course treating it well. I am very confident of that. But the only thing is during the transportation, there is a possibility that there might be cross contamination happening.
Okay.
Right. So of course, you can trust the source of that water, but there is a possibility that the water might be contaminated, and you should get it tested.
Got it.
And even filter water, as I told, we already had a conversation. You also need to understand the health of the filter, and is it unnecessarily removing excessive minerals that is actually good for your body.
Okay.
Right. So it makes a difference. You need to still test your water even if it is coming out of a filter.
Got it. Got it. So next one is water testing is expensive and only for industries. So what is the truth?
I would say you falling sick is more expensive.
Correct.
Right. And of course, as I told, there are different packages that you opt for. We can always guide you. It's not one size fits all approach. We understand your needs, and it starts from a simple. If you're talking about simple physical parameters, that hardly cost you the cost of a biryani, right? And if you're going for a full-fledged water testing or 20 parameters, I think it's just one weekend out, going from movie and just eating popcorn. I believe you can afford to spend so much at least once in a quarter. And again, I think you getting sick is more expensive than no, you thinking about is water testing expensive.
Correct. Correct. Means you should do this preventive healthcare. What do we
Exactly.
say, right?
And the entire the name Prewel, how we came up is it stands for preventive. The pre is preventive and well is wellness. So the objective always has been to focus on the preventive healthcare of it.
Yeah.
Right. Diagnostics is one industry where people call it as preventive, but I still call it as a corrective healthcare. Correct. Because you don't go to simply diagnostics until unless a doctor doesn't recommend you. Correct. So there is already an issue in your body, and you're going to the diagnostics, and they are only identifying what is the issue. But true preventive wellness or preventive healthcare is when you take care of what you eat, what you drink, and what you breathe. Yeah,
correct. Absolutely correct. So next one is about boiling the water. So people think that if I'm boiling the water, then everything is fine. Is it correct?
To a certain extent, I would say. I take simple example of hardness. There is something called as temporary hardness and permanent hardness. Right. So temporary hardness is something that can be managed by boiling the water. Okay. Right. But permanent hardness is something that even if you boil the water, it will not be taking care of it. Okay. So for that, you need a different set of filters. If you're in an industry, or even if you're having high, and you're living in an area where there's heavy TDS and heavy hardness, they also give you something called as pre-filters, so that your main filter is not taking the load. So what happens is, to simply put, not going into too much of technicalities, what is temporary hardness and permanent hardness. Again, just boiling the water, probably if there is some microbial contamination, when you boil it, then of course it will be killed. But the problem here is boiling is not a standardized approach. Right. What temperature, how many minutes, how do you boil, a lot of parameters. And I still believe that it's an inconsistent approach. So because today you have a lot of technologies, advanced technologies today, right, we should not completely rely on boiling today.
Got it. Okay. So moving towards next segment, which is focus on solution. Okay. So what does a typical water test include, and what should people expect in a report?
Okay. Usually we break this report or test into three parts, as I've already mentioned: the physical parameters, the chemical parameters, and the microbiology parameters. Depending on what kind of package that you're choosing in, we will help you to opt that package, and we run through those tests. Right. So your report typically consists the parameters that you've chosen and what is the result of your sample, okay, against the standard benchmark, and whether it is complying, or it's what we use conforming, or whether it is not conforming to the IS 10500 specification. So, and this is what you get when you ask for a report.
Got it. So, for example, somebody has tested their water and they have found the contaminants.
Okay.
So, what are the basic, measures that they should take?
Okay. It depends on what kind of contamination we are talking here. If let's say the contamination is with excessive hardness, okay, or excessive TDS, then of course we recommend you to go with any kind of RO filters. It might be any brand for that matter.
Okay.
Right. But if you are talking about microbiology contamination, then we recommend that they should usually go for a UV filter or another ultrafiltration UF membrane. So that is what we suggest. At the same time, if there are better models today in the market, we hear sometimes, right, there's a TDS controller and all. I would suggest that if those models are available today, better to spend a bit more and buy those models, because you can actually try to regulate the TDS there. So if you can do that, then I think you have an advantage.
Got it. Moving towards the next question, how do you envision the healthier communities through better awareness of water quality?
See, our philosophy always has been, to build healthier communities. We need to bring in a lot of awareness, because unfortunately, though this is a very serious problem and a very known problem, people still don't act on it.
Okay.
As I told, it's not immediate. It's not you're going to drink and you're going to die. It's chronic, and like we are all today are more inclined towards instant gratification. We don't want to wait. Nobody sees so much. That's how even one of the challenges when the topic of global warming comes, and nobody is really worried. Everyone knows global warming is serious now.
Yeah, correct.
Right? But they're not acting on it, क्योंकि मुझे क्या फर्क पड़ रहा है? ग्लोबल वार्मिंग होगा भी तो 1000 साल में होगा, 500 साल में होगा, मैं थोड़ी जिंदा रहूंगा तब तक. I think this mentality is what the problem is. We all need to become more proactive rather than being reactive. कुछ ना कुछ होने तक हमें वेट करने की जरूरत नहीं है. I mean, we have this old saying, right? Prevention is better than cure.
Correct.
Right? And it's a classic proverb which actually makes a lot of sense, but because there is a lot of lack of awareness, and or probably people are not seeing this as a very serious issue, I believe until we don't change that mindset, until we don't create that kind of awareness in the in the communities, it's going to be a problem. It's going to be a bigger problem. Probably it's not that big today is what they're thinking, but we are already having, there's a lot of data. As I told, go and see how many deaths that's happening because of contaminated water, contaminated food, contaminated air combined. The numbers are staggering, but still nobody talks about it. Because right, I mean, you need to again, it's not just I would not say it's only the government's responsibility here. I think all parties have to come together here. The communities also have to take proactive steps. I mean, you cannot of course depend on government for everything, right? You can do whatever you can do. You create awareness, right? You do a bit of research, you work with labs like us, and any other lab for that matter, right? But try to understand what you can do within your communities, because communities add up and then it becomes a town and then a city, and then I think that's what our objective is. But the focus has to be on being more proactive than being reactive, and I think that's what we are trying to do through a lot of our campaigns. We're trying to educate people, right? We're doing our best, but we still haven't seen that kind of change. And I don't believe that only Prewel Labs as an organization can bring this change. In fact, I think all testing labs, government bodies, communities, they all have to come together, because India is such a huge country, right? So just by one company trying to create the awareness, I mean, we can just be the starting drop for the ripple. The ripple effect happens only when everyone comes together, and I hope that happens soon.
Correct. So, like for example, if I want to want to test my water, right, with Prewel Labs. So how Prewel Lab is going to help me in this process? Like, is it a very lengthy process? How?
No, I think it's very quick. You we have a website. You can drop in a message.
Mhm.
You can call us immediately.
Mhm.
And once you call, you just need to give the details.
Okay.
A couple of quick questions. It might
Mhm.
not take more than 2 to 3 minutes.
Mhm.
That's to understand why exactly you called us.
Mhm.
And once we get that information, we'll immediately assign a sample pickup guy.
Okay.
You need not worry. We bring
Mhm.
in the clean containers, sterile containers.
Mhm.
They'll come, they'll pick the sample.
Mhm.
Don't worry about it. We transport it, we do the test and
Mhm.
give the results. And once the report comes to you,
Mhm.
we'll also giving you a follow-up consultation
Mhm.
on what needs to be done. So it's a very simple process.
Mhm.
It's much simpler than you going to a diagnostics laboratory and then getting
Mhm.
your sample tested.
Mhm. Got it. Got it. So, any final tips for the viewers who might be thinking like water safety is, something which is, usually they take for granted.
Yeah.
So,
Yeah.
yeah.
See, water is essential. Water is an integral part of our life. And I believe it's high time that we start really looking deeper into what is there in the water. Don't just go by the claims, don't just go by the looks, right? You really have to get the water tested. And because see, water is something you can stay without food for a day, 2 days, 3 days, a week, but you cannot stay with the water. The moment you start losing water out of your body, your cells start dying. And so water is very essential. And the quality of water that you put into your body is also what makes a big difference. So I would suggest that people to become more proactive and ask simple questions like if your community is depending on a water tanker, there's nothing wrong in asking for a report. And we also would recommend you, rather than simply depending on the water tanker's report, you get an unbiased testing done. You take that, because I stay in a community, I stay in an apartment. We pay no monthly, right, your fees there anyway. So it's not a big amount. And especially when you're talking about an apartment community, right, or a school for that matter, right, it's not a big amount that you're looking at. So make sure that don't simply blindly rely on what the supplier is telling you. You need to validate it.
Yeah.
So there are labs like us available in the market. You can approach us. We can do an unbiased testing, a report given, because we have seen some cases where the reports what was given by the water tanker suppliers and what we have generated, there's a huge difference.
Okay.
Right. Basically, a lot of parameters were failing, but they have produced a report where all the parameters were passing.
Okay.
So even this happens in the market, unfortunately. So you need to trust. You need to work with a reliable lab and get the water tested and ask for information and bring that awareness. Start teaching your kids. It's not just about saving water. Saving water, we know we all need to save water because water is an exhaustible resource. We need to be cautious on how we use the water. It makes a big difference. But what we also need to teach our kids is on the other aspects of it, like the quality of water, the quality of food, the quality of air. And because today we are talking more on the water, I'm limiting my conversation to the quality of the water. But of course, what you put into your body is what you become, is what you eat is what you become, is what the hearing that we have heard, right? But I go up step beyond. I say what you consume, right? It might be water, it might be food, it might be air, it might be anything for that. Whatever you consume is what you become. I believe that you should really be cautious of what you're putting into your body and try to create awareness as much as possible if you have any knowledge that will help others.
Correct. So thank you for this conversation.
Thanks Arjun. Yeah, I hope that people got some insights into water testing. I think it's a very big conversation. We can, in fact, if we get a lot of response and people want to specifically talk on something very scientifically, we will definitely we can do another set of podcasts. We can share information to them. But it's a huge subject. Water testing is like it itself is a big subject, right? You can talk n number of days on this topic. But I believe today we have tried covering what is simple to understand and what is important to understand. Anyone who is looking for more information beyond this, they can always reach out to us and we can help them with more information. So I'm glad that I got this opportunity to do it, and I hope that this information is shared to as many as people possible, because as I mentioned, the entire purpose of Prewel Labs is to build healthier communities. And if the community is healthier, you are healthier, your community is healthier, the country is healthier, the economy is healthier.
Yeah.
And I think it's all linked.
Yeah.
And there's a foundation of everything.
Mm-hmm.
And I hope that this video brings in some kind of change and helps people in even the smallest possible way. I would consider this podcast to be very successful.
Yeah. Thank you.
Thank you.
Thanks for your time.
Yeah, thank you.